So let's just jump into this.
Let's just jump in.
Yeah, who is TJ Horn?
Wow, it's a big question just to jump into, isn't it? Currently, I'm somebody who absolutely just loves what I do every day when I come to work. I have a belief system of how I think people should be treated, and how I live my own life in terms of my own staying connected to myself and trying to live fully in my life in a fun, loving, caring, compassionate way towards myself and others, and that is what I bring to my practice, so that my clients and patients get that when they come here, that this is a safe, nurturing place for wellness, for integration, for really getting people to enjoy the quality of their life.
So what is it about your personality that allows you to do that? I mean, what do you bring to this office in your practice?
I mean, my own personal journey, I've had to find my way. You know, I grew up with my own belief systems of that I wasn't worthy enough or good enough, and yet something kept helping me put one foot in front of the other and to keep finding my own truth and to keep expanding and growing into all the possibilities that I can be. And so I think through my own personal journey of growth and exploration and coming to some eventual peaceful, loving, compassionate terms and feelings for myself, I think that I take what I've learned and I can help nudge and encourage others along that journey.
Nudge.
Nudge.
What a great word.
Sometimes it's nudge. Sometimes people might feel it's a little more than a nudge, but it's always with a gentle, loving, kind spirit.
Okay, but as long as people keep on with their own personal journey, how many people do you see that they don't recognize that they're on a journey and that they're it's all a process. It's all a changing process.
Well, there's two kinds of people. There's many kinds of people, but in terms of that, there's people who don't recognize they're on the journey of maybe wellness per se, but they know that they're on something and they stay with the process. You know, like I see that a lot. People might come in for, say, a knee problem, and we're really tying in many aspects of life that they may not know they came for all of that. So they're on a journey, but they're not sure what journey they're on necessarily. But then there's the people who they don't necessarily want to. They have an idea that they want to be better, but that should be some instantaneous switch that somebody sets off, and there doesn't need to be any personal investment or reflection in that.
Okay.
And that's a different kind of, I'm not part of the process.
You've said a couple of things that to me are intriguing. One is that it's a process, and also to reiterate about the journey. But you started talking about if somebody comes in with a knee problem,
Mm-hmm.
it sounds like there's a process. It's not just manipulating the knee and getting it better and then they're gone. What is the process for that you go through?
Well, there's two big pieces. One is there's the actual physical piece.
Mm-hmm.
And a lot of times when people think about their bodies, it's usually when they have a pain, a symptom or a pain. Usually it's pain that gets them in the door. And what people don't realize is that symptom is the cause and effect of that is very complex and goes back in time. So it's not just this point in time I had pain, therefore something just happened to create pain. Our bodies are with us from in utero to present day. And so a lot of people come in and they think that whatever happened to their knee is some immediate process that then has an immediate fix. And there's ways that we can reduce symptoms, and there's ways that we can fix some of the problem, but for me, when I work with somebody, I'm not just healing their knee in this moment here, but also having to balance and release everything that's happened over time that's impacted that knee. Does that make sense?
Yeah.
To you?
But I need you talk to me a little bit more
Yeah.
about release, because again, maybe I'm coming in with a knee problem, maybe I'm coming in with a neck problem. Maybe that's just something that is wrong in my whole body. I don't know.
Right.
But what is it that you're releasing?
We have our bodies are made up of lots of structure.
Mhm.
So I could go through all the structures of muscles and ligaments and tendons and nerves and blood, and the biggest daddy of them all is fascia, which is a connective tissue. So our bodies, so in a perfect world, if I had a nice, I usually use like a big white sheet to show this, but if I had a nice perfectly ironed starch sheet, that would be sort of this ideal what our bodies would look like, in terms of everything's perfectly aligned and no wrinkles in the system. But all it takes is a little wrinkle somewhere in the sheet or a pulled thread, for example, somewhere, and that's going to have an impact everywhere else in the sheet. It won't be obvious necessarily, but it does. And little by little, this little wrinkle here might cause another wrinkle somewhere else, and maybe it jeopardizes the integrity of that sheet, and then another thread gets pulled or a couple threads get pulled, and little by little over time, the integrity of this sheet is now very much changed. And I can't just go and fix this one little piece of the sheet and think it's all fixed. In order to bring that back to its original form, I need to heal the whole sheet. And that's what happens in our bodies. Our bodies, one of my sayings in my practice is I don't work in isolation because we don't function or exist in isolation. Our bodies are connected, head to toe. So a change in one area in the body creates all this compensation and shifting in other areas of your body. So by the time someone comes in with their knee, there's lots of other changes that are occurring that then support the pain and dysfunction of this knee. And I usually refer to it as somebody's internal environment is perfectly set. So now when you wake up this morning, Jim has pain in his right knee. Because your whole internal environment, all the physical structures, are perfectly set up for you to now have the pain, which brings you to my office.
Okay. I want to go back to the term you just used, fascia.
Mm-hmm.
Am I pronouncing that right, fascia?
Mm-hmm.
Okay. It sounds like you're equating fascia in your body with a sheet. What exactly is fascia? Is it the connective tissue?
It's one form of connective tissue, and there's different kinds of fascia, depending on. There's a loose form of fascia, which surrounds our organ systems, and then there's a more dense fascia, which is it's tougher, and it can often be deeper and more resistant throughout the body.
Okay.
And it runs everywhere. I mean, its fascia surrounds and separates and supports almost every structure in our body.
Okay. I played a lot of sports growing up, and even into my early adulthood. And I kept saying to people that I can play with pain, that I can keep on going, even though there's hurt knee or hurt shoulder or whatever. What gives somebody the ability to keep on going and not bowing to the pain?
Well, there's a lot of answers to that question. One is pain is subjective. So not everybody experiences pain the same way. And we can shut ourselves off. Some of us have an amazing ability to shut our pain off if we think the end reward is greater. So it's amazing how if we don't want to go to work, our pain gets really big. But if we want to play in the game after school, well, our pain's only a little bit. So pain is very, very subjective. There's lots of reasons why one person will experience pain differently than another.
Let me see if I get this straight. Are you saying that there's a mental aspect to pain?
There's a physical aspect, there's a mental aspect, and there's an emotional aspect. I mean,
Okay.
how we all, how our bodies respond. I mean, there's a whole nervous system structure related to pain. So why some people get more fired up in terms of what neurons are fired up that create pain versus another, it varies from person to person. our interpretation of that pain signal is different. How we can shut off, or some people just disconnect from their bodies in a not so healthy way. Because that's what they have done to protect themselves for other reasons. Like for people who have had physical trauma, for example, they're going to shut down different parts, so they're not going to feel pain the same way. So pain is a fascinating dimension to work with in here. Because it is so absolutely different for everybody. It's a unique experience, and so much importance gets put on pain, and because that's people's reason for coming in oftentimes, and people use that as the measure of success or failure. I had pain, I still have pain, and pain is just one dimension, and that's a piece that I try to work with people in understanding that there's all these other dimensions that go on in their life that impact what's happening in that moment.
Which leads to the title of your practice. You just recently changed it, but it was Integrated Physical Therapy.
Mm-hmm.
So that sounds like you can't just deal with one facet, you have to deal with everything. You've just added "and counseling" to the title of your practice. Talk to me about that.
I love it. One of the reasons I opened my practice almost 11 years ago now and became integrated physical therapy is because I felt that in traditional physical therapy, which I did inpatient care, I did orthopedic, is I felt like there was something missing from being a physical therapist. And so by having my own practice, I was able to just really land and create something I believe in, which is so much about the human experience. It's about this. And so in working, as I kept working in physical therapy, and totally changed how I approach physical therapy, because I naturally evolved into the craniosacral therapy practice, which opened up a whole different dimension for me. A significant piece of craniosacral therapy is somato-emotional release. Somato meaning body. So really looking at how emotions are manifested physically and what impact that has on the physical body. And so that just became such an amazing piece, because so many people in physical therapy and others in counseling, everybody wants to treat things in such isolation. Isolation. It's like, I'll just do my little piece here, but there's all these other so many important pieces that are important for the well-being, for the healing. And so I started doing the somato-emotional release and really realized that there is no way we can just treat the physical person and not deal with the emotional. That they are, for me, essential that they come together. And I was doing the somato-emotional release, and I started feeling like I'm bumping into professional boundaries. And I don't like to bump into professional boundaries. So that's when I went back to school for counseling and got my master's in counseling. And now I can just really feel the freedom to integrate. So now when somebody comes in, they may come in for physical therapy, but we can expand into counseling. Because as I was going to say before, when you were asking me about the knee and the process, for some people it's a physical process of over time that we have to work with. For other people, there's a whole emotional process that supports this dysfunction in the knee. So now I have people come in for a physical problem, and we can expand into counseling. And I have people who come in for counseling, and instead of just sitting there and talking, we can actually really move into body. And to me, it's just my dream. I mean, I have just created something I so much believe in every day when I come to work.
What's the responsibility of the patient? Because you seem to be doing all of this work externally.
Oh, no,
What
no,
is the
no,
patient?
no. Let me correct that. Let me correct that. The client, patient, has all the responsibility. First of all, we work in collaboration. So I don't do anything. Sometimes I think I have the easiest job in the world because I don't do anything. I read bodies. That's what I do. I'm a better body reader than book reader. But so I can't fix anybody. I can't get anybody better who doesn't truly want to be better. And people don't want to, people, those that want to be better and truly in the deepest sense want to get better, show up. They're here. And there's a recognition that this process isn't always easy, especially if we're dealing with emotions. And so we ride this journey together, and that's their responsibilities to show up, to work in collaboration with me,
Okay.
to be very much part of this process. There is nobody I can get better, physically or emotionally, who doesn't want to get better. Trust me. I've tried that. It doesn't work. And there's a saying, I don't know who was the originator of the saying, but heard it many times over. I had to learn it the hard way by trying, but you can never work harder in anybody's therapy than they're willing to work themselves.
Okay. Would you ever tell a patient, you're not trying hard enough, so we can't accomplish anything here?
I've said that, not there's ways of saying it,
Yeah.
I've absolutely, I've, had the hard conversation with people. Some people realize it and bail, like, I thought DJ was just going to fix me, and how come I'm not just getting fixed? And so I guess this isn't working. I go and they leave, and that happens. So some people just take themselves out of the
Okay.
equation, but there are people that will come in for either physical therapy or counseling, and we do sometimes we just need to explore this process together. Sometimes I need to say, you've missed the last couple weeks, and so I know you're having a hard time right now, and your pain in your back is really flared up, and I'm just going to invite you to look at the fact that perhaps other things in your life are a priority. You're not getting here, So some people need to learn that to take care of themselves is okay. Other people need to learn that they have to be part of this process. So depending on who it is,
Yeah.
I meet people where they are, and we try
Go
to
from
move
there.
together. Yeah.
I see you as a person who's always growing. You're always taking courses, you're getting another degree, whatever. Where do you see yourself in 10 years in your growth journey?
Wow, that's
Yeah.
there. Well, I'd like to be playing my trumpet in a musical in 10 years.
Here you go.
I hope to be dancing in some way, shape, or form. Professionally, the beauty for me, of my life, as in my career, is that I have not ever sat down and charted my journey.
Okay.
What I have done is I have lived fully in my experience and have naturally evolved into what the next door is. So I can sit here right now and I can say, well, if I go back to school someday, I would go for ministry, believe it or not. I do body, I do emotions, now let's do spirit, right?
Yeah.
So I would definitely think about becoming a minister or something.
Okay.
And there's tons of things I want to study in terms of counseling. Love it, right? Love ways of keep integrating. So, but I'm just going to come here every day, and I'm going to be in the experience of who I am and the work that gets done here and the people and the growth, and just being 100% present in this process.
Yeah.
Let it unfold. I mean, I thought I was going to be a basketball coach, and a gym teacher one day. I never thought I'd be like doing the work I do right now. And I started out at massage school because that's what I did kind of naturally, doing my thing, and then fell in love with studying the human body. And next thing you know, I'm going to PT school, and I never thought when I went to PT school, I was an athlete. Now I'm working. Can I put my hand on you? Now I work with like that much light pressure, and from there I went to counseling. So I'm just open.
Yeah.
I just like
It,
landing and exploring and playing and being curious, and that is what I try to bring to my client.
yeah.
That energy, that spirit.
I think that's the interesting part of this conversation that I've heard, is that your journey of life is very much like your process here
Mhm.
in the office, because you
Right.
have to find where your patient is at this moment and then go from there. You seem to be coming to a fork in the road and you're taking it.
Yeah. Yes. Yeah. I love it. I love this process,
Good.
and
Well, it's obvious.
Yeah. So many directions to go, and with my work with clients, getting them to be connected to their own experience, to what's happening presently in their life, and how they can take the steps. They can learn how to gradually keep expanding and landing and creating the life that they want for themselves. And we get to do it, physical to emotional and back, and it's a beautiful thing.
One last word. Give me one word.
One word.
Yeah. That sums you up, sums your practice up, and I am going to force you into just one word.
Connected.
There we go. Thank you.
Thank you.